Hi, I'm Arjun. I recently passed my PLAB 2 exam on my first attempt. For my preparation, I had taken Dr. Mo's classes. I went to Dr. Mo's Academy and I had taken Dr. Lovaan's Masterclass as well. So I thought this would be a good opportunity for me to tell you about my experiences and how I used these classes to prepare for my exam. But please note, this is just my experience, how this helped me to clear my exam, and it can vary from person to person. Different people can have different opinions about these classes, so I'm just trying to help you to choose, to decide whether you should take these classes. By the end of the video, I would request you to draw your own conclusions based on my experience. Well, about Dr. Lovaan, well, honestly, I don't know much about him. I don't know about his professional background, but all I can tell you is that he's an amazing teacher, and he's been teaching this PLAB 2 for a couple of years apparently, and he's really good at it. And he takes classes, I think, twice to thrice per month, and I attended it in January of this year, and he takes it through the Zoom meeting, online Zoom classes. Sometimes it can go up to 12 hours a day, so that's a bit exhausting. But here I'll discuss about the positives and the negatives of his class in detail. The most important positive point that I felt about Masterclass is that Dr. Lovaan will give you a very detailed approach, a structure, a very clear structure on how to approach each station. It is really important because during the exam, we may face some new stations, some new cases. So if you don't know about the management, or if you have no clue about it, but if you have the structure on how to approach the case, it could be a follow-up scenario or a test result scenario. So at least if you have the structure, then you can face that new station. So Dr. Lovaan, he has developed a lot of methods. He has developed a lot of methods himself regarding this, like the 4-question method, the 4-box system method, and he has even explained an approach using a diagram for follow-up approach. So when you are lost, all you have to do is just remember the diagram, just remember that flow, the flow chart, and then you can easily approach the scenario. So I found that really helpful, because it helped me as well when I faced a new station during my exam. I followed Dr. Lovaan's approach, because you see, there are different kind of scenarios that you're going to get. There'll be problem colleague, medical errors, LGBTQ stations. So all these stations, how to approach them, how to deal with the patient, what to do is very important. Another important point is that he focuses on the do's and don'ts. He'll give you an idea about what you should not do. And sometimes we use a lot of technical terms during our role play with the patient. Dr. Lovaan will tell you the alternative question that we can ask in those places. And also things like during a phone call scenario, instead of introducing first, you first ask, you first confirm the patient's identity first, just to make sure that you're talking to the right person. So those are very minute details we may miss. So Dr. Lovaan makes it sure that we focus on such things. In every scenario, he'll mention something like this: some common mistakes we do, some common things that we should avoid. So it's really important that we take note of all those things. And the next point that I found to be positive is that his management, the management in every scenario, they're important. Well, he focuses on every aspect: data gathering, IPS, and the management skills, which are the 3 main domains which you'll be assessed, as you might be knowing already. So some academies, their notes, they're incomplete and they don't focus on management part well, but Dr. Lovaan makes it sure that we focus on all the important points which we have to say during management part, and that is a very good positive point. And he focuses on the IPS and the history taking part as well. So I'd still recommend you to go through the NICE website, the NICE guidelines. Maybe some of them get updated now and then. Overall, Dr. Lovaan, what he says about the management part in each scenario, they are enough he covers all the major points. So if you don't have time, you can just rely on what Dr. Lovaan says. The next thing I found is that, which I found it really helpful, is that his focus on scenarios like breaking the bad news, medical errors, problem colleagues, LGBTQ stations. These are very difficult stations personally for me. So his approach to these stations are very detailed. He takes a lot of time to explain all these scenarios, because these scenarios can be challenging, because they require you to put a lot of emotions, show a lot of empathy. So we have to be very careful with these scenarios, and Dr. Lovaan will give you a very detailed approach regarding these scenarios. And some academy notes, they are not really well written when it comes to these scenarios. So I heavily relied on Dr. Lovaan's notes when it comes to when it came to these scenarios. Also, during his class, he'll tell you if he's discussing, for example, in a scenario where the occupation of the patient is a person who work on a scaffolding. So he'll tell you in which other scenario this can happen, like in which other scenario the patient's occupation is working on a scaffolding. So so that we'll connect these two scenarios together. We'll remember, so that we can advise the patient during management that that the patient should try to avoid working on scaffoldings because of these balance problems. And also he'll connect all those scenarios together, which is a very good thing. Dr. Lovaan also mentions about his 10 favorite topics. Those 10 favorite topics, those are the major topics. They tend to repeat at least one of them. They come every day. So those are really important topics which he mentions in his class. I really admire the level of dedication he shows in his class. I agree that his class can be tiresome, but he is a man full of energy, and he shows a lot of dedication. He spends the entire day teaching non-stop without taking proper breaks. He'll give us break, of course, but his energy is not lost. He's committed to teaching us the entire thing. So even if normally the classes are scheduled for 3 days, and usually I don't think they work for 3 days, because he makes it sure that he covers all the important topics. So when I was taking the masterclass, it went up to 5 days. And apart from these classes, he takes another revision class a few days before the exam. He'll take another revision session which lasts for around 4 hours maybe, in which he'll discuss the new scenarios that's been coming these days, like that's been coming recently. Speaking of the negative side of his class, well, there aren't much negatives about his classes, but the major one is that the timing of the class. Well, he has to take it. There's no other way he can cover all this, around 200 to 250 scenarios in total. Because I attended his class when I was in India, before I came to the UK for PLAB. So the Indian time it started around 2:30 p.m. in the afternoon, and it used to go till 2 a.m. at the night, not 2 a.m., even till 3 p.m. because towards the end of the class, he'll ask us for if we have any doubts. So there will be a doubt clearing session as well, which of course is beneficial, and because many people, they will ask their doubts, and Dr. Lovaan makes it sure that he answers all of them. And he takes it from 9 a.m. UK time, I guess. I always used to fail to stay awake late night. So by 12 midnight I used to feel sleepy, even though my parents, they helped me. Without them, I couldn't have imagined this journey. But during the masterclass, I still remember my parents and my aunt, they used to bring coffee and food for me while the class was going on. So I would suggest you to do the same. Prepare yourself for the masterclass, prepare coffee, stay awake, and you'll be part of a WhatsApp group. So there will be many PLAB aspirants in that group. They'll support each other. So if you miss any topic, you can ask for that particular topic's notes in the WhatsApp group, someone else who might have, who would have stayed awake would definitely provide you with the notes. He doesn't cover few topics like pediatrics, so there are a few topics which he tends to miss, and he'll tell you which topics he's not covering. Men's procedures, of course, we'll need academy for that. And the other important point is that some people, they may find the teachings from the academy different from Dr. Lovaan's style. Both styles, they may find it difficult to, sometimes it might be contradictory as well. So it is up to you to take the best out of both and create a plan on your own. Most of the masterclass topics, most of the masterclass points, they are valid and they're good. So ultimately, what I'm trying to tell you is it's up to you to decide which point is important, which point you can exclude. Now, the important question is Dr. Lovaan's masterclass absolutely necessary to pass PLAB 2 or UKMLA? The answer to that question is no, it's not absolutely necessary. You can pass without his classes too. I know a lot of friends of mine who didn't attend his class, so it's possible of course you can pass without his class. But if you ask me if I recommend his class, I would say yes, I do recommend his class, because personally it helped me. And if you ask me whether I relied on Dr. Lovaan's notes exclusively, I would say no, I didn't rely on his notes completely. As I mentioned, I also went to Dr. Mo's academy. Of course, an academy is also important because there you'll have to have hands-on practice on clinical scenarios, the simmons and the procedures and so on. You need to have practice with the mannequins, so you need to choose an academy, of course. And the thing is that I used to study both notes, Dr. Mo's notes and Dr. Lovaan's notes as well, and that's how I studied. But a few of my friends, they used to exclusively refer Dr. Lovaan's notes as well. So the ultimate decision depends on you. Also, I'd like to stress the fact that things does not always happen according to the masterclass. If you expect something different in the real exam, you should not blame the masterclass or anyone who said that masterclass is the ultimate source. No, it does not happen like that, because I guess GMC changes everything every day. Some kind of modifications they do. So it's really important that you keep that in mind and have your own style, not to follow any script. Just take all the good points from all the classes or the sources, and then develop your own style, and then practice and practice. And use the masterclass as only a guide, as only a source of information. Do not entirely rely on masterclass, but take all the good points, the basic structure, and then practice accordingly. Give your own modifications. So that is really important, because people who have attended the masterclass, they have also failed the exam. It's not as if everyone who attended the masterclass has passed. There are many people who have failed too, because it's really important to develop your own style of interaction. So that's really important. So I wish you all the best for your exam, and I hope this video was beneficial for you. I hope you had an idea about what to expect in his class, and whether you should choose this class or not. So thank you for watching. If you have any other doubts, please feel free to ask in the comment section, or you can also send me an email. I'll try to answer as much as I can. And if you'd like to know anything else, please feel free to ask. Thank you.